We are Confluent Care, and we're here tonight to talk to you about the problems faced by community health workers and our technology that helps them do their job better. We believe that strong communities and personal relationships are essential for health. So community health workers are big-hearted people who work with vulnerable patients that are in difficult situations. And they don't do it for money, they do it to make a difference in these people's lives. They visit the patients in the home and help with everything from understanding their new diagnosis and their doctor recommendation to even finding food when money runs low at the end of the month. They spend up to an hour and a half with that patient. They get to know the family, they see everything in the home that's affecting health, and in a way, they're like liaisons between that patient and the healthcare system, helping connect them with the resources they need. But they're not the only people doing this work. A lot of different professionals do this kind of role, but don't call themselves community health workers. So when we refer to community health workers, we're going to talk about everyone who's doing this kind of home care. The ACA brought changes to the healthcare system, moving it from a fee-for-service to more of a value-based system. And in that system, community health is very important, and community health workers are considered the way of the future. But they're stuck using yesterday's tools. When we spoke with community health workers, we learned what's paying them today. And a lot of it is that they're wasting time and resources. So they're printing papers that get lost, they're playing phone tag and missing appointments. Another problem is that they can't keep up with their clients between appointments. So if they see that patient once a month, there's 30 days in between where they can't know what the progress is. And then they can't show their impact to their employer. So when their patient does have success, the healthcare system doesn't see it. So we're going to talk now about, there are 117 million people in the US who have a chronic condition. And with the ACA, a growing number of those people are covered by Medicaid. When Medicaid patients go to the hospital over and over for the same condition, those readmissions cost the healthcare system $26 billion annually. When community health workers are doing their job well, they're keeping those patients out of the hospital, and that saves the health system money. So now we're going to take a look at our tool using these two personas, Tiffany and Sam, that we designed based on our customer discovery research. So Tiffany is a community health worker, and when she opens her app, she can see her homepage and her patient list, which she can sort in a variety of ways, and her patient here it's showing Sam. Then she can make appointments and send messages where she can attach the educational resources that they looked at together. And she can send behavioral reminders, which are like a task that will help Sam reach the goal that they decided on. And she can check the progress to see how he's doing in meeting that goal since they last met. On Sam's side, we have Sam, he's in his 60s and a diabetes patient, shown here with his granddaughter. Sam, when he opens the app, can also see his homepage, his appointments, and his messages, where he can open those educational resources that Tiffany sent, and he can see his behavioral reminders. So did he take his medications this morning? What was his blood sugar reading? And then he can see his progress. Has he been walking more in the evenings like he said he would? Has he been doing it more than he did it last month? Besides these basic features, we have some key features we'd like to highlight, and the first is predictive analytics. Predictive analytics can take all this data and triage the patients for the community health worker. So if there's a patient who stopped taking their medications, won't respond to messages, missed an appointment, they'll jump to the top of the community health worker's list to show that that's someone who needs attention. And that can help the community health worker use their time wisely. Predictive analytics can also be used to find patterns in data. So we might learn that there are certain types of patients who benefit from certain types of care. And the community health worker can use that to really individualize what they're doing and prevent problems before they happen. Another key feature is gamification. Gamification is what keeps the client using the app. It gives them points and levels the more health behaviors that they log, and when they do reach a goal, it automatically shares it with their community health worker so they get that positive support, and they can even choose to share it with their social network. There are a lot of different companies that have proven out these features. MyFitnessPal works for behavior tracking, Outlook works for secure messaging and calendar, and there have even been companies that have given tools, technological tools to community health workers, but they've done it with very limited feature sets. Our competitive advantage is that we have a very comprehensive feature set, and it's specifically designed for the work that community health workers do and their relationships with their clients and their employers. And in that sense, our value proposition is multifaceted. So for the community health worker, they're able to provide better care, and they're also able to see more patients, so they're doing more for less. On the client side, they have more immediate access to their community health worker. So where they would have gone to the doctor or even the ER with a concern, they can now get an immediate response. And they have more motivation for the notoriously difficult task of behavior change. For the healthcare system, or the health plan, or the community organization that's employing these community health workers, they're getting all of this data about that patient population that uses so many of their resources. and they're getting data about the impact of the community health workers. And these are insights they've never had before. So our total addressable market is all community health workers and all of those care coordinators, social workers who are doing this kind of work. And that's 2 million people in the US. If you look at those that are only employed by health systems, which is our business plan for now, that's 600,000. We are making our obtainable market about 2% of that, which brings you to 12,000. And those are the people who we think we could obtain who are using the kinds of roles that would directly match our feature set. But as our feature set expands, so can our market penetration. And every time that we get a new customer, it's a health system. And we get the user base, that's all of the community health workers in that system and all of the clients they see. So our user base in that sense can grow very quickly. We're charging a monthly fee per community health worker that's using our app within the system. And with that 2% market penetration, that generates $22 million annually without the non-renewable engineering fees and any sort of fee we charge for advanced analytics. This summer in TechArb, we've made a lot of progress. We've done customer discovery, we've developed this business plan, and done front-end prototyping. And in the fall, our goal is to show that front-end to more Medicaid patients to get their feedback, to continue building partnerships with health systems to identify pilot sites, and then to do some back-end developing. And when that back-end developing is ready, we hope to pilot in the winter and spring. Our team is uniquely ready to take this to market with a really diverse skill set. We have a background in health behavior research, data analytics, healthcare IT, healthcare management, and user experience design. So far, community health workers have been overlooked by the tech sector, but they're the ones on the ground promoting health. And with the ACA, this is more important than ever. And so we ask that you support community health workers and invest in us. Thank you.